Thank you, Madam Speaker, and I thank the Honourable Member for the question. Madam Speaker, first and foremost, I'd like to clarify that there was no raw sewage leakage or raw discharge in the Navua Creek from the Navua Hospital. Madam Speaker, for the information of the House, let me briefly explain the process within the sewage system at the new Navua Hospital. Raw sewage is contained in the first holding tank as part of the sewage system, which has 3 chambers, and this is where the first filtration process takes place. The contents of the sewage, Madam Speaker, is separated from the first chamber holding solid waste, while the second and the third chamber provides filtration of the liquid waste. Furthermore, the liquid, which is basically water, then goes to a second tank where further filtration is done before it's pumped into the treatment house, which has another holding tank with inbuilt filtering system. Madam Speaker, then the water goes through another 4 chambers that act as a soak pit, allowing the residual water to seep into the ground. Yes, Madam Speaker, a minor leak of filtered water had occurred as the volume of wastewater was in excess of the capacity of the designed soak pits to absorb. It was quickly remedied by the Divisional Medical Officer Central and his team. In terms of other clinical waste, Madam Speaker, they are disposed and burnt into incinerators. Concerns were raised by the villagers of Navua if there was discharge of raw sewage. And our team, after citing water discharge into the nearby creek, the team had taken immediate actions to consult with the communities, and so far there has been 4 consultations that have been held with the neighbouring villages, including Navua over the last 4 weeks, with the most recent one last week, Thursday, 10th May, during my visit to Navua, and I also met up with the village representative. The Divisional Office of the Medical Officer Central has been working with the local team at Navua Hospital, and this includes the engineers on site with the Ministry of Health team, Ministry of Infrastructure and Transport, Water Authority of Fiji, Ministry of Provincial Development, Commissioner Central Division's Office, Ethiopia Affairs in consultation with Rokoto Inamosi to consult the communities. Our most immediate remedy, Madam Speaker, was to bail out the septic and soak pits on a weekly basis to prevent any spillover. So far, 3 bailings have been done with the assistance of the Water and Sewerage Department of the Ministry of Infrastructure and Transport. In terms of the upgrade works, Madam Speaker, the engineers have built drains to properly redirect any storm water from collecting on the rooftops that may have contributed to the excess water being channeled into the sewage system. Further on, the Minister of Infrastructure Sewage Monitoring Unit has advised that the long-term solution is to procure and install a 2 by 20,000 litre tanks to store this wastewater, treat it with chlorine as appropriate, and this can be recycled for either watering of the landscape or by controlled release into the man-made wetland that's a soak pit. Madam Speaker, water samples have been taken as of last week by the Minister of Infrastructure to the Kinoya lab to confirm the effectiveness of the current filtration process within the current sewer system at Navua Hospital, and this would also enable further improvements in the treatment process of both solid and liquid waste. Communities have been assured that immediate actions are taken to amicably address the issue, and till today weekly bailing of the septic tanks are carried out. The proposed definitive solution will be established through the multi-sectoral meeting, which is planned to be held with the communities on 24th of this month, while we verify the results of the chemical analysis test of the water that has been taken. Madam Speaker, based on the results of the test, the Ministry, through its collaborative support, will undertake the other appropriate actions to enhance the level of treatment for the liquid waste to ensure that it can be recycled. Thank you very much, Madam Speaker.